to med administration. Today I'm going to be going over administration of medication, oral, liquid, injections, patching, and yeah, that's it. So first thing to always keep in mind are the rights to medication administration. So you have the right medication for the right patient, the right dose, the right time, the right route, right documentation. Patient has the right to know and the right to refuse. I believe I hit them all. So other things to keep in mind, obviously when I enter the patient's room, I'm going to be introducing myself. I'm going to be identifying them properly using 2 identifying markers, having them state their name and date of birth. Also going to be using the AMR system appropriately and scanning wristband and medications. If I were to draw anything up or prepare medications in the med room before entering the patient's room, if possible I would use a barcode on the syringe, or at the very least, if that system wasn't in place, write all the information on a piece of tape or something on the syringe with my name when it was prepared, date, and patient's name and date of birth. Alright, so oral administration, obviously we don't have a pill cart here or a crusher, but I would make sure that the pill was properly scored so that it could be cut in half. Any kind of time release medication or anything like that, obviously we wouldn't open. You'd always check with the pharmacist if need to be to see if that medication can be crushed or dissolved or scored in half. Also, as far as liquid medication, which we have some yummy cold and flu medication here, I would always pour at eye level so I could see exactly what I was doing. Keep in mind if it was 5 or under milliliters, I could also use a syringe to administer the medication. A few other medications to talk about. So as far as optic medications, for those medications, it's very important that we do not instill them right onto the eyeball or anywhere but the conjunctive sac. So I would pull that down, drop them in appropriately. Again, definitely not getting them on the eyeball. Eardrops, I want to, for an adult, pull up and out. I want to have them comfortable either, tilting their head or side lying, whatever is most convenient for them. And then again, up and out, instill the medication, and place a cotton ball if necessary. And then last but not least, for these types of medication, nitro paste. So if a patient has a patch on already, I want to remove that old patch using different locations, but I can just clean away any remaining medication with a tissue. And then as far as actually putting on new medication, you use the strips like you showed us in the video, squeezing a certain amount out depending on how many inches was ordered, applying that to the patient's skin, clean skin, and then securing that, and then making sure that I date it, time, and, my initials. And last but not least, inhalers. So a few things to keep in mind with inhalers. If there are multiple doses to be given, we want to make sure that we're given the appropriate time in between doses, not right back to back. Also, with inhalers, especially with steroids, you want to make sure that you allow the patient to rinse their mouth out. As far as the procedure, so you want to have the patient firmly wrap their lips around the inhaler. Actually, have them take a couple deep breaths in and out before you actually do the procedure. Then wrap their lips around the inhaler, nice and secure. And as they're inhaling, you want to have them depress the medication, take a deep breath, and then exhale through pursed lips. So we're going to be talking about a few different types of injections. Couple things to note ahead of time. Obviously we don't have vials or anything to demonstrate, but I would obviously clean the vial, top of the vial, letting it dry. I would also clean the patient's skin appropriately, letting that dry, circulate in and out. And the 3 different types that we have here for an intradermal, subcutaneous, and an intramuscular. So intradermal would be a 25 to 27 gauge needle. A 1/4 inch to 5/8 inch, can be up to 1 mil, and that is given at a 15-degree just under the skin, and that is typically used for like a TB test. So that is your tuberculin syringe. Next, here we have a 3 ml, which I would use for a subcutaneous injection. So that needle would be like 3/8 to 5/8 inch, and gauge-wise like 25 to 31. That can be up to 3 mLs. That would be given at either a 45 or a 90-degree angle. And what I didn't mention, which I'll go back to with the ID, is the location. So with subcutaneous, I would either 2 inches from the umbilicus, pinching the skin, giving the injection that way. The intradermal, typically given right here. Again, that's just under the skin. And then last but not least, we're using a 5 milliliter to demonstrate intramuscular, or IM, which would be anywhere from 1 to 3 inches in needle length, and then anywhere from 19 to 25 gauges. If it was a bigger dose, I'm showing you on a 5 ml, but if it was a big dose, like I had to give 5 mLs, I would obviously give that in 2 injections. And areas that are typically used for this type of injection would be deltoid, the ventral gluteal, the ventral laterus, and for this it would be a 90-degree injection as well, like the subcutaneous. So the subcutaneous is 45 to 90, but this won't be straight in 90. And just demonstrate as if there was actually medication in there. I'm going to go in smooth, steady, and nice, and smooth injection.